MedInsight.
Ladies and gentlemen, welcome to MedInsight, your trusted source for medical insights. Today, we have an intriguing topic to discuss, one that is quite familiar to many of us, paracetamol, also known as acetaminophen. Now, let's get serious and embark on a comprehensive journey through the pharmacology of paracetamol. Our objectives for this lecture are as follows. To gain a thorough understanding of paracetamol's pharmacology. To learn about the recommended dosages for different age groups. To familiarize ourselves with the various routes of administration for paracetamol. To recognize special considerations when prescribing or using paracetamol. To understand the potential adverse effects of paracetamol. To explore the drug interactions that can occur with paracetamol. To grasp the necessary warnings and precautions associated with paracetamol usage. To learn how to manage cases of paracetamol overdose effectively. To appreciate key summary points that will help us consolidate our knowledge. Now that we have set our objectives, let's move on to the heart of our discussion. Paracetamol. Paracetamol, also known as acetaminophen, is a non-opioid analgesic and antipyretic drug. It's commonly used to provide temporary relief from fever and pain. Whether you are experiencing mild to moderate pain or battling a fever, paracetamol has got your back. When it comes to dosages, we have different recommendations depending on the age group. For adults, the oral dosage ranges from 325 to 650 milligrams, taken every 4 to 6 hours as needed. Higher doses of 1 gram can be taken every 6 hours if necessary, but be cautious not to exceed 4 grams in a day. Now, let's talk about our younger folks. For infants, children, and adolescents, the oral dosage is based on weight. A general guideline is 10 to 15 milligrams per kilogram of body weight, administered every 4 to 6 hours as needed. Just remember, the maximum daily dose shouldn't exceed 75 milligrams per kilogram, up to a limit of 4,000 milligrams per day. Now, let's not forget about our little ones. Infants and children below 2 years of age can receive 15 milligrams per kilogram every 6 hours via intravenous administration. For children aged 2 years or older, the dosage varies based on weight. Those weighing less than 50 kilograms can receive 15 milligrams per kilogram every 6 hours or 12.5 milligrams per kilogram every 4 hours. Similarly, children weighing 50 kilograms or more can follow the same dosing regimen. If we shift gaze to intravenous dosages, we need to consider the weight of the patient. Adults weighing 50 kilograms or more can receive 650 milligrams every 4 hours or 1 gram every 6 hours. For those weighing less than 50 kilograms, the dosage is 12.5 milligrams per kilogram every 4 hours or 15 milligrams per kilogram every 6 hours. It's essential not to surpass the maximum single dose and daily dose limits to ensure safety. Moving on to adverse effects, paracetamol is generally well tolerated when taken within the recommended doses. However, in rare cases, an overdose or individual susceptibility can lead to hepatotoxicity, so be cautious. Other possible adverse effects include skin rash, allergic reactions, and gastrointestinal disturbances. We also need to be mindful of potential drug interactions. If you are taking medications like warfarin, be aware that paracetamol may increase the risk of bleeding. Similarly, the combination of paracetamol with carbamazepine, phenytoin, or barbiturates may heighten the risk of hepatotoxicity. And let's not forget about alcohol. which can increase the likelihood of liver damage when combined with paracetamol. Moving on to warnings and precautions, it's crucial not to exceed the recommended dosage. Patients with liver or kidney disease should use paracetamol with caution, as well as those with alcoholism or chronic malnutrition. Monitoring for signs of hepatotoxicity is essential to ensure your well-being. Finally, in the unfortunate event of an overdose, it's imperative to seek immediate medical attention. Paracetamol overdose can cause liver damage or failure. The antidote, N-acetylcysteine, NAC, can be administered within 8 to 10 hours of the overdose to help mitigate the effects. To sum it all up, paracetamol, also known as acetaminophen, is a widely used analgesic and antipyretic drug. Dosages vary based on age, weight, and condition. By following the recommended dosing guidelines, we can avoid adverse effects and ensure our well-being. Remember, if you have any doubts or specific concerns related to special populations, always consult your healthcare provider for personalized dosing recommendations. That concludes today's comprehensive lecture on paracetamol. I hope you found it informative and engaging. Thank you for joining me here on MedInsight, and until next time, stay healthy and keep those fevers and pains at bay with the help of our friend, paracetamol.